Welcome back to Good Day Stateline. We are visiting our friends at MD Skin Center. We have Dr. Melissa Stenstrom with us again. Good morning.
Good morning.
So we are talking about skin cancer awareness because that's what's happening in May. It's Skin Cancer Awareness Month.
That's right.
So tell me why this is so important.
Well, it's important because skin cancer is the most common cancer overall in the United States, and the incidence is still increasing. So skin cancer is somewhat preventable. There are things that we can modify so that your risk factors are decreased, and it's very treatable when caught early.
Which is like really good, all those things, but people are still not doing all the right things.
That's right.
What happens? It's hard, but that's what you're here to tell us all about, what we
educate a
can
little
do.
bit.
So how can we prevent it?
Well, it's preventable by reducing sunburns, especially those sunburns that happen early in life. So protecting children, protecting our young people, and teaching them good habits early. It's also prevented by reducing tanning bed use, actually eliminating tanning bed use. So now in a lot of states, tanning bed use for under 18 years old is actually illegal. And so that's been very good to kind of get the word out that that is a known carcinogen now. So we want to avoid tanning beds at all costs. And then reducing our UV exposure on a daily, regular basis. So wearing sun protective clothing, avoiding that midday sun, and using your sunscreen and your sun protective clothing.
Sunscreen has been around for a long time, but some of those other things are recent. So many different things we can do, including, like you said, sunscreen. And you have a product that you want to show us, right?
I do. So one of my favorite sunscreen brands is called Ulta MD, and this is a very common recommended sunscreen by dermatologists. So one of the reasons is it has a good percentage of zinc and titanium. So zinc oxide and titanium dioxide are two very protective ingredients. This one's really nice and elegant. It's made for daily use, just to put on as your morning moisturizer every day. Face, neck, and upper chest.
Okay, so this is like a facial one, not the rest of your body?
They make all of them. This particular one, which is called UV Daily, is meant for, and that's why it's so small, meant for the smaller areas.
Okay, so I don't know if I'll put it on my arm, even though I have makeup on.
You can.
Put this underneath your makeup, right?
You put it underneath your makeup first thing on.
It's not going to hurt my arm when I go driving later.
No.
I'll be very protected.
You'll be good, protected.
And it smells good and it's not greasy, which is so important, right?
Right. It also comes in a tinted version, so in the summer, some people just use it as their tinted moisturizer, almost like a light makeup.
I like that. That's a fun idea. Plus, it's not going to probably clog your pores like makeup does.
Correct. Non-comedogenic. Yep.
Super plus. So what should we watch for when it comes to, hopefully preventing skin cancer, making sure we're aware?
So the most common types of skin cancer are going to present like a non-healing sore, almost like a pimple that bleeds easily or just won't heal up. And those often a patient would recognize. But melanoma, which is the more deadly type of skin cancer, usually has no symptoms until it's in a more advanced stage. So it really requires some visual detection, looking for moles that are changing in size, shape, color, or a new mole that doesn't look anything like your other moles. We call it the ugly duckling sign.
So I'm guessing this is one of the main reasons, obviously, why you would come here and just on a regular basis so you can monitor the changes in somebody's body.
Right. Yeah, so, the back and the back of the legs, and those are places that are really hard to see yourself. So coming in and having a baseline full body skin exam, we do that very often, and then we're able to monitor for changes along the years.
And you have another doctor that we're going to talk to. Tell me about him.
So Dr. John is he's a Mohs specialist. So he's a Mohs surgeon who specializes in the removal of high-risk skin cancers, particularly on the face or larger lesions on the trunk. So he's treated thousands of skin cancers, and we detect many every year.
All right, Dr. Jen, Dr. Stenstrom gave you a very good introduction, so we don't need to cover how awesome you are. We just want to hear about Mohs, so tell us about it.
Mohs surgery is the most effective way to take a skin cancer off of the body. It's especially effective on the head and neck. If one were to come in, we would do everything in the clinic. We would keep you awake. We would remove the tissue, process it all here, and by the end of the day, the cancer is typically all gone.
That seems really fast.
Yeah. I mean, it's the way I would want it done.
So how long have you been doing the surgery?
Technically 18 years.
Okay. What's like the alternative? Like, what is this better than?
It's better than a standard excision where they don't look at everything, they just look at part of the cancer. It's better than radiation therapy where the recurrence rates are 10 times higher than with Mohs surgery. So in every way it's better. It's safer, we don't put you to sleep, it's less expensive, we don't have to go to the hospital. In all these ways, it's better.
And how often do you perform the surgery?
We do it 3 days a week,
so
sometimes
a lot.
4. Yep.
If anyone wants to hear more about all of the things you guys do here or learn about you or any of the other doctors, where could they go?
They could go to our website, mdskinrockford.com.
So our next giveaway is actually from MD Skin Center. We've got sunscreen, eye cream, Vital C cream, a moisture treatment, under eye patches, and a signature hydrofacial, all in that cute bag. You know you want it. Enter now at gooddaystateline.com. We're popping into Dairy Queen on Riverside in just a few minutes. So we asked you at mystateline.com/GDS, where's your favorite place to eat ice cream? You said the couch, which is clearly the best answer. This week, we want to know, what's your favorite type of vacation? Is it a beach vacation, amusement parks, historical sightseeing? Vote now at mystateline.com/GDS. We'll be back in just a sec with your CBD store.